Hello, good morning. My name is Temilade and you can call me Temi, and you're welcome to my YouTube channel. I'm filming from south part of Nigeria. Top of the day to you in any part of the country you're watching from. In today's video, I will be talking about changes and adaptation in pregnancy. Pregnancy. And before I start this video today, I would like to acknowledge my lecturers in School of Nursing, School of Midwifery, Mrs. Akinyemi, Mrs. Adefisan, and Mrs. Adebola. I'm very grateful to you for imparting this knowledge to me and also making me to impart it, enabling me to impart it to others. So now let's dive into the topic proper. So the changes and adaptation in pregnancy. The first thing I would like to talk about is physiological changes in the reproductive system. Though there are a lot of physiological changes that may occur in other systems. You know, the body is comprises of different systems. Like we have the integumentary, that is the skin, the reproductive that I'm about to talk about, the respiratory, name it, they are much. But today I would like to start with the reproductive system. So first of all, the reproductive system in male and female, they are different, but I would like to talk about the female one first. For the female reproductive system, we have the ovaries, the uterus, the fallopian tube, the breast as an accessory organ, the cervix, and the vagina. So now to the uterus. Before I will talk about the physiological changes during pregnancy, I think I would just like to first of all talk briefly about the anatomy of the uterus. Though I'm going to be talking about it, but not in an in-depth version, because I don't want my audience to be blank and I don't want them to be struggling with my medical jargons. It's meant to be a knowledgeable session, and so that you can gain something, one or two. So for the uterus, the anatomy of the uterus is a hollow, pear-shaped muscular organ, and it is located in the true pelvis. It is anti-version and anti-flexion, that is, it's lean on itself and it's also lean forward. It weighs 44 kg. That is in a non-pregnant woman. It is 44 kg in weight, and a non-pregnant uterus is 7.5 centimeter long, 5 centimeter wide, 2.5 centimeter in depth, and 1.25 centimeter in thickness. That is for you to know that this thing is small, but it's not actually too small like the way some people can be viewing it, and it's not too big. And it has 3 layers. The endometrium being the innermost layer. The endometrium consists of the ciliated epithelium, and it changes constantly during menstruation, during the menstrual cycle, while the basal layer does not alter. It does not even respond to any hormones. It just stays on its own. Then the myometrium, that is the middle layer, the muscular layer, and that is by far the thickest among the 3 layers that I mentioned, among the 3 layers that I'm going to be mentioning. And to me, I can say it's the one that performs bulk of the work during pregnancy, because it allows to stretch, it continues to stretch and accommodate the growing fetus and the growing uterus. Then we have the perimetrium. That one is just the outer layer that covers up the endometrium and the myometrium. Also, the uterus has the the organs in relation, like the kidney, the livers, and the likes, the way they are situated laterally, beside, the one on top, below, the one in front, that's the anterior, and the posterior. But I won't like to just dwell much into that, so that not to bore us with a long speech. And also it has the supporting system, that is the ligament that holds them in place and everything. So I would just like to leave that part and go into proper. So the function of uterus, as we all know, uterus is what we laymen, uterus is what they know as womb. So for people that are in the environment, uterus is also the same thing as womb. So the function of womb, uterus, the main function is that it helps to nourish the developing fetus to birth. Don't forget that is where the uterus is going. That is where the fetus, and the fetus is a baby in utero, the baby that is still inside, that has not yet come outside. When the baby is not yet outside of the uterus environment, you can call it a baby. For medical terms, it is fetus. So, and also it helps to prepare for pregnancy each month. Each month, the uterus work judiciously, just to continue to prepare that place for pregnancy, just in case this person is pregnant, the baby will have a suitable place to implant and grow properly. But when the uterus continue to prepare and there's no pregnancy, then that's when it will shed away the layers, and the couple with some vessels, some blood vessels, some tiny vessels will rupture with it, and everything will shed out to form menstruation. That's when your menstruation will come out. Then it also helps to expel product of conception following pregnancy. The product of conception is the baby, that's the fetus itself, placenta, and every other thing. Everything will come out following pregnancy. Now to the physiological changes proper, because for us to know few things about the anatomy, so that we can understand the physiological changes in proper. Physiological changes, the myomenstrual, just like I said earlier on, the myomenstrual, to me, I can say is the one that will almost perform bulk of the work, because it's during pregnancy, it's going to stretch and accommodate the growing fetus and the growing baby, so that there will be space, there will be enough space. Now the weight and size during pregnancy or for a uterus is going to change. Don't forget that the normal in a noniparous woman, that is a woman that has not given birth, that has not carried pregnancy before. So the normal uterus weight will be 44 kg. But during pregnancy, it will stretch and stretch until it reaches 1,100 kilograms. Consider that is a lot of work, and that is why in my tribe they will say that, like muscle. When you are dealing with, imagine you are eating meat and you are dealing with the muscular part of the meat, and you are trying to stretch and stretch. You know how that thing can stretch, like the capacity, the elastic limit that it can stretch to. So the same thing with the uterus too. The uterus can, especially the myomenstrual part, the muscular part, will continue to stretch further and further, just to accommodate the growing fetus and the growing baby. Also, the size of the uterus, like I said, it is 7.5 centimeter long, 5 centimeter wide, 2.5 centimeter in depth. It's going to increase, and this time it's going to increase to 40 centimeter long, 22.5 centimeter wide, and 20 centimeter in depth. That is a very, very long way, and that is why we have to credit our pregnant mothers. They are doing a nice and beautiful job. It's not easy there, it's not just easy out there. I have to commend the expectant mothers and the mothers that have been through their parts. Well done. You are really a superhero. So now to changes in uterine size and shape. While in school of midwifery, whenever they want to talk about the sizes, they want to relate the sizes, for they like to make comparison with fruit. I don't know why. Maybe if you know the reason, you can please put it in the comment section. We learn every day. But they like to make comparison with fruit. I think maybe because fruit is something you can see. Like fruit is the fruit that they made comparison with, they are the fruit that on a daily basis you can see them, so you can use them to relate to what is going on in utero, what is going on in my uterus, how the baby is growing. So for 5 weeks, it is a size of a small, unripe pear. Although I'm still going to put a picture in this video. I'm going to put a picture there so that you can see the visuality of it. Like, at least what I think, what there's this saying that what you see stick better, what you see and hear stick better. So I'm going to put a picture below, like a picture in this video for you to see. And at 5 weeks, it is the size of a small unripe pear, while at 8 weeks it is like a large orange, like a large level orange. At 10 weeks it is a size of a grapefruit. You know that grapefruit that you eat, so something like that. It is like that. Then at 12 weeks it is like a melon seed. You know melon, that in my tribe they will call it egusi. So that melon that you eat, the bulk of it, I'm not saying the pieces, when it is still inside the shell. So at 12 weeks it is like that size. At 16 weeks it is globular, almost round. I can say almost round, almost spherical, but it is globular, it is not round yet. And at 20 weeks it is round and palpable. And all I mean by palpable is when you visit your physician, your midwife, they will be able to palpate the fetal part, the fetal lie, the baby is viable, the baby is growing, the baby is okay, that they will be able to palpate everything and denote the position, the lie, and everything that they want to record at that 20 weeks. And at 30 weeks it is round too, but at that time it's growing. It's really growing way too far. So it displaces the abdominal organ up. It wants to, so that I can say this, at that stage the uterus is a little bit selfish, trying to create space for itself, so that there can be enough space for itself to grow better and further. So it displaces the abdominal organs, like maybe the liver, the kidneys, and the likes. It displaces them a little bit upward to also stay there to accommodate and to grow better. And at that stage, at that 30 weeks, the size of the uterus is at the umbilicus. The umbilicus for the layman is navel. My tribe will say idodo, so what I'll put a subtitle below. So my tribe will say idodo, that is your navel, like ear. At that time, that your physician, your midwife can feel it at that place. So, and at 12 weeks too, let me put this there. At 12 weeks, the uterus, the growing uterus, move from the true pelvis. It is normally the God designed the uterus to be a pelvic organ. So at 12 weeks, due to the fact that it's growing, and don't forget that the trimester is divided into 3. That is the first trimester, second and third, and it is 3 months. That is in medical they use weeks in calculating, so 38 to 40 weeks. So the first 3 months is 12 weeks. So at 12 weeks, the growing fetus leave the true pelvis to move upward and stay in the abdomen for pending the time and still grow there. And at that time is when the pregnant woman begin to feel less frequent urination, because at that time because the uterus is located in between the bladder and the rectum. So if the uterus is in the true pelvis, any small urine that is in the bladder, due to the growing uterus, it will be pressing the bladder and making the bladder want to expel out any urine. Even though if it is 50 ml or 100 ml of urine that is in the bladder will just want to expel it because of the growing uterus that is pressing on the bladder. So at that 12 weeks that the uterus has moved out of the pelvis to the abdominal organ, the woman will be relieved a little bit from visiting the toilet frequently, or relieve a little bit from frequent urination. And also the woman will be able to sleep better at night, because frequent urination at night, waking up and going to urinate, will disrupt your sleeping pattern at night. That is what brings about the insomnia, and insomnia is just lack of or absence of sleep. So weight in pregnancy, the amount of weight usually gained in pregnancy, according to research, according to statistics, it is the average weight in an averagely built woman is supposed to be 12.5 kg, And I'm going to be using the basic the body mass index, that's the BMI, to calculate, to tell you the average weight that a pregnant woman is supposed to gain as per their BMI. If you don't know how to calculate your BMI, you can Google it, and you just have to know your weight and your height, and we use it to calculate your BMI. And that is to some extent a standard tool that can make you to know if, okay, I am healthy enough, I am not fat, I am moderately obese, I am severely obese, or is or herself. So for a moderately, for somebody that the BMI is less than 18.5 kg, the person is expected to gain 12.5 kg in pregnancy, during pregnancy. And for somebody that is weighing, that the BMI is less than 18.5 kg, that means the person is weighing, like, if I'm not wrong, that means the person is weighing less than 50 kg. That is less than a bag of rice in Nigeria. And for BMI of 18.5 to 24.5 kg, the person is expected to gain at least 11.5 to 16 kg. Like, it's just a range. It will be. In fact, I will even advise the person not to surpass that 12.5 kg for somebody that is weighing 18.5 to 29.9 kg. For someone that is 24.9 kg rather. For someone that is weighing 25.9 to 29.9, that is for the BMI. The person is expected to gain 7.7 to 11 kg during pregnancy. While for someone that is over 30 kg, that's the BMI, that is even over 30, that means the person is like obese. The person is expected to gain 5 to 9 kg during pregnancy. Also, the weight gain, because in pregnancy it is divided into the first 20 weeks and the last 20 weeks. That's for 40 weeks in total. The weight gain is 12.5 kg. That's for the average. Then it is now divided into the first 20 pregnancy. The woman is expected to gain 4 kg. That is 0.2 kg per week. In a week, that's 0.2 kg. Then for the last 20 weeks, that's the second 20 weeks, the woman is expected to gain the remaining 8.5 kg. That is 0.4 kg per week. And what made up the weight is just the product of conception, starting from the fetus, the placenta, the amount of fat, the extracellular fluid, the amniotic fluid. Everything add up to be the 12.5 kg that the woman is expected to.